Thank you for the opportunity to present my Cancer Literacy Information Center innovative app idea, also known as CLIC. It is designed to provide standardized cancer information and care, as well as streamline communication between healthcare professionals and patients. Cancer is a complex disease that requires an immense amount of information for treatment and care. CLIC is tailored for oncology patients and any healthcare professionals that care for adult and pediatric oncology patients. In Ontario alone, the prevalence of cancer is being projected to reach approximately 1.2 million per year in 2034. In 2022, there are approximately over 17,000 oncologists and oncology nurses in Ontario alone. Currently, healthcare professionals have to search for printed materials or visit several websites to gather information, which can be time-consuming and ineffective. The CLIC app will provide a single platform that has all the required information to share with patients with a click of a button. Patients will also be able to access their health records and track various appointments. There will also be artificial intelligence that will assist the patient to determine if their symptoms need emergency attention, a nursing team call, or can be self-managed safely at home based on the patient's medical history, current medications, and current symptoms. It will also display the current wait times of whichever location the patient chooses, and the location will be informed that the patient is en route with the GPS with their ETA, their current symptoms reported, and the possible diagnosis per AI. This will help the ER operate more efficiently and decrease wait times significantly. It will also allow for patient and patient's healthcare team to collaborate within the app. With the help of artificial intelligence, clinicians will also be able to access information on the most recent and relevant clinical trials that is specific to their patients. Healthcare professionals will also be able to access research grants and be able to set reminders to apply. The fifth component is the ability for healthcare professionals to easily track their continuing education hours, which will save significant time. To develop a polished app, it will cost approximately $700 to $1 million initially, and approximately $10,000 to $20,000 to maintain the app. If we estimate that 60% of doctors and nurses in oncology were to subscribe monthly, there will be enough revenues to cover the maintenance of the app. Any further revenues generated from other clinicians and pharmaceutical reps will go towards funding continuation education hours for oncology health professionals. Patients will not be charged to use the app. Ultimately, the patients will benefit from the up-to-date knowledge that their healthcare team can use to provide quality patient care. The hope is that CLIC will be able to expand to other disease sites and to the rest of Canada. The main vision for this healthcare app or platform is to link every system of the Canadian healthcare system that handles patient information to be accessible on demand to patients, hospitals, outpatient clinics like physiotherapy or naturopaths, doctor offices, surgical offices, health insurance, workplace insurance, research, etc. Patients will be able to access their health information and decide who gets access to what portion of their health information. Hospitals, ERs, paramedics, emergency triage like 911 will be able to access up-to-date patient information and be able to provide required intervention as necessary. Patients will be able to submit fillable forms to doctor consults, insurance, and outpatient clinics, and making reimbursements, doctors, and outpatient consults more efficient. The macro vision is to include other disease sites and launch the rest of Canada. From there, once metrics have been collected, we will be able to illustrate to other countries what we were able to accomplish in Canada and sell license to other countries. The fee will be based on GDP of the country. Eventually, the entire globe will be using this one platform, so no matter where one travels, their health information is easily accessible. Thank you for taking the time to listen to my pitch. Please connect with me if you have any questions.